Hey everyone, welcome back to the channel. Today we're diving into a really important and eye-opening report that came out of Canterbury, New Zealand, about the mental health services there. It's a scathing report with some major failings that need to be addressed. We're talking about tragic events from 2022 and 2024 where psychiatricians. This has raised some serious questions about the state of mental health care in Canterbury and what needs to change to prevent such events from happening again. So let's break this down and see what the report says, what the recommendations are, and what Health New Zealand is doing to fix things. It's a heavy topic, but it's crucial that we talk about it. Let's get into it first. Let's set the scene. In 2022, there was an incident at Hillmorton Hospital where a patient named Zakaria Hussein was released into the community and then went on to stab Lesa Waka, a 53-year-old woman, outside her home in Christchurch. That was a tragic event. Then, in October 2024, another patient, Elliot Cameron, murdered an 83-year-old woman named Faye Phelps in her garden. These two events have shocked the community and have led to a major review of the mental health services in Canterbury. The report that came out today is the result of that review. It's called the Inspection into Canterbury Waitāa Adult Inpatient and Associated Mental Health Services, and it was ordered under Section 99 of the Mental Health Act. The purpose of the review was to find out if there were any systemic issues with the mental health services in the region. The report found 9 key findings. Let's go through them one by one. The first finding was that the region's mental health services were struggling under the weight of accumulating legacy impacts from several major events. These include the earthquakes that hit Christchurch, the Christchurch terror attack, the impact of the pandemic, and a 35% increase in the prison population. All of these events have heightened demand for services and have caused long stays for patients due to ongoing impacts on housing, blocking community reintegration, and delaying admissions. The report points out that this is a significant issue that's been building up over time and is now putting a lot of pressure on the system. The report says this is the most significant and prevailing issue across adult inpatient, community, and forensic services. There are daily struggles to maintain minimum safe staffing, levices, which is a huge problem, in forensic mental health services. The report found that there is an imbalance. This is a real concern because if you don't have enough experienced staff, it can compromise the safety of both patients and the public. The third finding was that bed closures, early discharges, and reduced interventions have followed these staffing shortages. This has resulted in readmissions and increased pressure across the care continuum. It's like a vicious cycle where not having enough staff leads to more patients being discharged too early or not getting the care they need, which then leads to them coming back again. The fourth finding was about staff morale. The report describes it as poor, with reports of burnout, a culture of blame, and significant to staff learning and development. This is a serious issue because if staff are burnt out or don't feel supported, it can affect the quality of care they provide. The fifth finding is about mandatory training and quantify. The sixth finding is about a siloed culture and care model that has impeded cohesion between disciplines. This means that different departments or teams aren't working together as well as they could, which can lead to communication breakdowns and a lack of coordination in patient care. The seventh finding is about the incorporation of te o Māori being inadequate. The report says that Māori cultural support should be fully part of the service, not an add-on. There needs to be a senior Māori health leader who supports the Māori mental health team and ensures that there is a collective Māori voice at the leadership table. This is a crucial point because cultural competence and inclusion are essential for providing effect. The eighth finding is about ineffective governance. The report says clinical governance is reactive and focused on immediate issues at the expense of longer-term stewardship. This means that the focus is more on dealing with problems as they come up rather than planning for the future. The escalation process are difficult. The regional leadership has also delayed decisions on business cases aimed at fixing staffing and seniority gaps. The ninth finding is that there's a lack of strong leadership. The report recommends that leadership should build a culture based on servant leadership and just culture, which means shared accountability and open and honest peace. This is about creating an environment where everyone feels responsible for the outcomes and where mistakes can be reported without fear of punishment. Now let's talk about the recommendations. The report focuses on three main areas: governance, care model, and resource pacing. The goal is to improve cooperation, plan for the future. The recommendations include governance must prioritize and focus on forensic mental health service performance by fixing staffing, vacancy issues, and multidisciplinary model of care. The link between service and regional leadership. Teams must be stronger with clear processes for making decisions, sharing information, and daily. Leadership should build a culture based on servant leadership and just culture, which means shared accountability and open and honest reporting. Mori cultural support should be fully part of the service, not an add-in, and a senior Mori health leader should support the Mori mental health team and make sure there is a collective Mori voice at the leadership table. All staff should be involved and valued, and it should be made clear that bullying in all forms is unacceptable. Serious incident reviews also need improvement. Health New Zealand has responded to the report and said it is committed to implementing the recommendations to try and prevent the tragic events of 2022 and 2024 from happening and host you. Feel Grady the Health. NZ National Director of Mental Health and Addictions has expressed deep sorrow for the families affected by the incidents and has apologized for the failings in the system. He mentioned that there has been demonstrable progress on key recommendations, including establishing a clinical governance fragrance for clinical decision-making on patient leave is now consistent with policies, and there are weekly audits of compliance in place. Grady also said that there are clear pathways both within the service and nationally within health. To ensure progress continues, they welcome Dr. Crawshaw's increased oversight of the service over the next 12 months. They are committed to improving the service and will be closely measuring their actions against the report and two other event reviews conducted by Health NZ. So what does this all mean? It means that there are serious issues with the mental health services in Canterbury that need to be addressed. There are staffing shortages, poor governance service. The report is a wake-up call, and it's clear that changes need to be made. But there's also a commitment from Health NZ to implement the recommendations and make improvements. It's a long road ahead, but it's a necessary one. The families who have been affected by these tragic events deserve our support and our attention. We need to make sure that the mental health system is safe, effective, and responsive to the needs of all communities. There's a lot of work to be done, but with the right leadership, resources, and commitment, I believe it's possible. Thank you for watching this video. If you found this information useful, or if you have any thoughts or comments, please leave them in the comments below. Don't forget to like and subscribe for more content like this. And if you're interested in mental health or want to learn more about the challenges in the healthcare system, I encourage you to follow this channel. Until next time, stay safe and take care.